Black women are 3 times more likely to die from pregnancy-related complications than white women. There is clear and present bias among healthcare providers that contribute to disparities in treatment among Black women, which often lead to less favorable outcomes, right? Poorer outcomes. And not only is this an alarming statistic, it is a reality for many, many Black women, one that I have lived through when my ectopic pregnancy was mishandled by an OBGYN that misread my ultrasound, right? And an ambulance company that ignored the urgency of my condition. So countless Black women are dismissed, misdiagnosed, mishandled, and left to suffer because of racial bias in maternal health care. And real quick, this video was inspired by a post that I shared on my Facebook page, Tiffany Masika, from a woman who is speaking on behalf of her sister. She's advocating for her, who is currently in the hospital fighting for her life due to a delayed, misdiagnosed ectopic pregnancy. Again, you can read this post on my Facebook page for more details. But from the details that were shared in that post, it sounds like this woman has a medical malpractice lawsuit, judging from what her sister shared. And I'm glad that her sister shared this, right, along with the updates, because ectopic pregnancy, this is not a common situation, ectopic pregnancy. It's life-threatening, and it's frankly, it's nothing to play with, right? And I think that women who have had an ectopic pregnancy, regardless of the severity, should share their experience if they feel comfortable doing so. I'm not saying that they should, as if they're obligated to do so, but it would definitely help other women and their loved ones know what to look for as far as the signs and symptoms, right? It could potentially save another woman's life, because I almost lost my life in 2011 because of medical negligence. And again, because I am of the demographic of women who are mishandled, misdiagnosed, and mistreated in the maternal health care system. This is a thing. This is a thing, whether people want to believe it or not, right? It's happening. I had already had 2 children at that time. My youngest was just learning how to walk, right? She was just learning how to walk. I think she was probably 9 or 10 months when I found out that I was pregnant again. I'll never forget that day. Me and my children were at my mom's house, right? I was upstairs with my youngest, getting ready to take a nap. I was about 6 weeks, 6 or 7 weeks pregnant at that time. I was laying down no more than 10, 15 minutes, right? When I felt the most excruciating, unbearable pain. I mean, it just hit me swiftly, like a thief in the night. It just hit me. It woke me up. It sat me up immediately. It felt like I was being stabbed in my pelvic area, right? It was worse than labor pain. It was sharp. The pain was so sharp, and it was relentless. From what I remember, I mean, it was relentless. It was literally breathtaking. Like, for real, like it was taking my breath away. You ever been in so much pain that you can't even cry? All I could do is really just sit there. That's all I could do, was just sit there, because it was consuming me. You know, it took over. My entire body felt extremely weak. And then I started feeling lightheaded. And then I got really, really nervous, because I knew something was terribly, terribly wrong at that point, right? I felt like I was slipping away, right? It was a very unforgettable, overwhelming, strange feeling. I felt like I was slipping away. At that point, I'm mustering up the little bit of energy that I had to yell out for help. My mom, she didn't hear me. She probably was downstairs at that time. I'm trying to recall, because this was a while ago. She didn't hear me calling out for help. Again, remember, I was weak. So my energy is basically leaving me. So then I started calling out for my son. At that time, he was about 9 years old, right? So I'm calling out for him because my mom is not responding. I hear him running up the steps. So he was downstairs. I tell him, hurry up, go get your grandmother. Tell her to call 911. Please, I need help. So he runs downstairs. I hear his feet running downstairs again. She comes upstairs into the room that I was in. Mind you, the room that I was in with my daughter, my youngest, was the same room that my grandmother had passed away in just 3 months earlier. Okay. So that in and of itself was strange, later on, after I kind of reflected on the whole situation. So anyway, my mom comes in. I can tell by the way that she looked at me, I must have been pale, right? Like my complexion must have completely changed the way she was looking at me. And she called 911 immediately. And so she also takes, the children with her so that they don't get scared and just to keep them calm. Ambulance gets there. I hear the EMTs walking up the steps slowly. Okay. A white woman and a black man. They come into the room, right? The white female EMT, she's asking me questions. What's my name? How old am I? Am I pregnant? How far along am I? Questions that my mother had already answered because she told me later on that she answered those same questions when she made the 911 call. So that alone tells you that, they were just time wasters at that point because the information that she had already gave to the 911 dispatcher, they already knew my name, age. They knew I was pregnant. My mom knew how far along I was, and she gave all of that information to them. And so they just come in and ask me those same questions again, right? Again, I'm weak. My energy, I don't even have energy like that. So then the female EMT, white female EMT, she asked me what's wrong. Mind you, I can hardly talk at this point, and I'm slouched over, holding my stomach. I'm telling her that I am in excruciating pain, right? Like oh God, this pain is unbearable. Please, I just need help. She says, well, okay, we got an ambulance van outside waiting for you. So her and the black dude, EMT, they each grabbed my arms, right, to stand me up as if I could walk. And I'm literally begging these people to not make me walk. I'm begging them, please. I cannot walk. I'm in so much pain. Please. I just need some help. I hear my mom asking them, like, why y'all don't have a stretcher? You know what I mean? Y'all need to give her a stretcher. She's telling y'all she can't walk. They either didn't believe me or they did and just didn't care. Right? And I'm inclined to believe that they did believe that I was in pain and they just didn't care. Or they didn't believe me. I don't know. I'm going to go with the latter. Right? They insisted that I try to get up and walk. And because I just wanted to get help, I mustered up enough willpower to stand up. And then I remember taking about 3 or 4 steps, right? I remember taking 3 or 4 steps and waking up in the ambulance. And I later found out that I had suffered a grand mal seizure. Again, I only remember taking 3 steps and then waking up in the ambulance. So I had lost consciousness. I didn't even make it out of the room. I collapsed right there. But looking back, the warning signs were there long before I collapsed. Looking back, because just a few days before all of this happened, I had gone in for an ultrasound for, my regularly scheduled prenatal appointment. But my usual OBGYN doctor, she was not available, a black woman, because I had intentionally and specifically chose a black woman as my OBGYN. Right. I've worked in healthcare, so I know that people, they will choose healthcare providers based on their race, based on their culture. Okay. And I did the same thing. She ended up having, like a family emergency that day. So instead, I was seen by a substitute OBGYN, an Indian lady, Indian as in Pakistan, right? Indian lady. This woman, I mean, she barely looked at me, barely spoke to me, right? And when she did, I could hardly understand what she was saying because she had a thick accent. And she just really made the entire visit feel rushed. The entire visit, it was strange. It was very off-putting. Even when she did the ultrasound, that was rushed. I don't even remember her actually, I don't remember her feeling, my pelvis, checking to make sure that was feeling normal. She just basically glanced over the ultrasound and that was that. Something felt off about it because I remember telling my husband and my other family members later that day that something had felt off. But during that time when I was at the appointment, I just told myself, that I was overthinking. And I basically pushed my discomfort to the side, trusting that, she was doing her job. You don't want to believe that this person is really being negligent while you're pregnant, while you're on a table, you know. Uh, a pregnancy should be considered a temporary disability, actually. You know what I mean? I had no idea that her lack of medical professionalism and oversight would contribute to this entire experience that I had. Because I believe if she had paid more attention careful attention, she could have spotted the abnormality of the developing pregnancy that I was experiencing, right? But she didn't. So this was just a few days before. I wanted to throw that out there. I had to put that out there for context. Getting back to the seizure that I had. So because I ended up collapsing in the room, never made it down the stairs. Of course, because the negligent EMTs had no other choice, they finally got me a stretcher to transport me from the room to the ambulance. Again, the white female EMT, she was the one really doing all of the talking and asking questions, while the black male EMT, he was quiet the entire time. She was clearly the one in charge amongst the two. Let me say this. I know that if I was not only a white woman, right, but if I was a white woman in an affluent neighborhood, I would have never been forced to try to walk down a flight of stairs after complaining of severe, miserable, unbearable abdominal and pelvic pain. I know this for a fact. I would have been on that stretcher off the rip. I know this. I know if I was a white woman in an affluent neighborhood, even if I told them, oh, yeah, I could walk down the steps. Yeah, I'm good. They would have made me lay my behind down on that stretcher, roll me down the stairs into the ambulance. I know this. And I'm not the type of person that makes everything about race. You know what I mean? Always pulling the race card because I don't operate from a race-based consciousness. However, I'm also not the type to bury my head in the sand as a way to avoid aspects of reality that are taking place right before my eyes, such as racism and discrimination, etc. Right? So I'm not that type of person, but this is what it was. So anyway, I wake up in the ambulance begging another EMT. This was a young white guy. I was begging him for water. Oh my God. Oh my God, that was a thirst that I have never experienced a thirst for water like I did that day. Now, I do remember him being helpful and kind. And, he said, oh, we're glad to have you back. You passed out on us. Your blood pressure dropped really low, but we're going to take care of you. I promise, right? He's cracking a joke here and there. He was doing his best to try to keep me awake. And I appreciated his presence because those other two bastards, they had pissed me off so bad. They really pissed me off. Meanwhile, I'm still pleading with him for water at this point. He apologized to me and tells me that, he really couldn't give me water if he wanted to in case I needed surgery. So he's like, the staff at the hospital, they don't like us to give patients who are arriving in an ambulance to the ER. They don't like us to give you guys water just in case you have to undergo surgery. He said, but once you get there, you could always ask them for ice, right? So he was cool. He was cool. Like I said, those other two that tried to make me walk down a flight of stairs and I ended up having to pass out. I lost consciousness behind that, right? So he provided a little bit of comfort. So again, that extreme thirst that I was experiencing, me begging him for water, I later found out also that was because I was losing a lot of blood internally. I get to the ER. They immediately hooked me up to an IV. The nurse asked me what my pain level was on a scale of 1 to 10. I tell her 100, right? She gave me some morphine and she also gave me the ice that I requested. And then they hooked me up to the ultrasound machine. Once she gave me the morphine, I was floating. I mean, I felt great. Oh my God. At that point, I just wanted to get everything over with, after she gave me the morphine. I said, do whatever y'all got to do. The surgeon came over and said, Miss Garcia, we got to get you prepped for emergency surgery. You have an ectopic pregnancy that ruptured your fallopian tube. We need to stop the hemorrhaging ASAP. And then that's when they put me under anesthesia. After that, I believe it was the next day, I remember them telling me how lucky I was that I got there when I did. They told me that if I had got there 5 minutes later, there was at least a 95% chance of me having a major stroke because of the amount of blood that I had lost, right? Because the fallopian tube had ruptured. That's why I was begging for water in the ambulance, because I had lost so much blood, which caused my blood pressure to drop to dangerously low levels. So when they told me that, I had to just sit there for a minute. This is why to this day, just as a sidebar, I live my life to the fullest. I live my life to whenever I get into a mode of not being grateful and complaining, I kind of just think back on that, not reliving the past, but just reminding myself what could have been. But yet I'm still here today. They said I had 5 minutes, 5 more minutes later, I could have been I could have been out of here. That could have been it. That could have been it. And because of the massive amount of blood loss, I had to have a blood transfusion. That was the day after the surgery because I remember having to sign papers consenting to the blood transfusion. That's how much blood I had lost. And I was in the hospital for at least a week, right? I was in the hospital at least a week. They wanted to make sure, of course, that the blood transfusion went well. My body didn't reject anything. They sent me home with some Percocets, and that was that, and I pretty much bounced back. I'm very, very resilient. That I know about myself. I have been through some things. That's just one thing. I'm extremely, as far as an emergency health situation, I'm extremely resilient. I bounce back. I've always been like that. That was a very painful and terrifying experience. So much so that I decided at that point that I did not want to ever, ever be pregnant again. And I stood on that, right? Because they told me that I could still get pregnant. They said you could still get pregnant. You have your other fallopian tube, your uterus, ovary, all of that. But the chances of me having another ectopic pregnancy was higher because I had already had one. I said at that point, no thanks. I was cool after that. I was cool. Get somebody else to do it. Get somebody else to do it. Right? That's where I was at mentally. So, although that pregnancy almost cost me my life, it ended up saving my life. That's the irony in that experience for me, because honestly, I wasn't really prepared mentally or emotionally to have another baby. So, after I recovered and everything, and I kind of got through, I guess you could say, grieving process, I was kind of indifferent. That was the strange thing. When I first found out that I was pregnant again, I wasn't super excited, but I wasn't disappointed. I was kind of lukewarm about it, right? And so when this ectopic pregnancy happened, and after I recovered and I had time to reflect on everything, I was happy. I was I was happy. I was satisfied. Let me choose that word. I was satisfied with how things went, right? It was traumatizing, but again, I bounced back, very resilient, and I just went on with my life. But I also decided that because of that experience, because I was that close to checking out of this realm, I said, you know what? I'm cool. I don't even want to be pregnant again. I'm cool on that. Let me go into the racial disparities, right? Remember the OBGYN? That whole experience was very off-putting. It was strange. I didn't feel right after that visit. And then we have the ambulance company. Again, had I been a white woman, they would have never made me walk after I complained of the extraordinary, unbearable, excruciating pain, right? So the racial disparities in maternal health care for Black women are deeply, deeply concerning. And it all goes back to systemic racism. I don't care what anybody say, which means that there are racist nurses, doctors, EMTs, and any other healthcare providers or professionals that you are entrusting your life with as a pregnant woman, as a pregnant Black woman. If you pay attention, whenever there's a case of medical malpractice being exposed, one of the main responses from the healthcare system in terms of what action they will take moving forward to prevent medical malpractice from happening again, one of their main responses is, well, we're going to require healthcare providers to undergo some courses, some education and training so they can recognize and mitigate any bias that can affect the patient's care. It's the same old song. They do it with the police departments. It's the same old song and dance. Because the fact of the matter is that you can require a healthcare provider to take classes and undergo more training. You could do that all you want. You can train them till the wheels fall off. None of that matters if the individual is racist in a world where systemic racism exists, period. None of that matters. The only thing that they're going to do is find more craftier, covert ways to practice racism, period. So when they respond in these situations of alleged or proven medical malpractice, I just laugh. I just, like, all right, really? Oh, we're going to make sure that we're going to require them to take some training and education so that they can identify racism and bias as a way to make sure that our patients are receiving quality care. Get the hell out of here. It's the same song and dance with them, just like with the police. Go train, and none of that matters if you're dealing with a racist. You can train them all you want. It's not going to change anything because the individual is racist. They're just going to become more craftier and covert in the ways to practice racism. That's it, period. So my main purpose in sharing my experience is to bring awareness on the warning signs and symptoms. Extremely important, especially again with that post that I shared on my Facebook, right? Because from what it looks like, people don't believe us. As Black women, people do not believe us when we tell them what we're experiencing health-wise, right? So it's up to us meaning the women, us, our husbands, boyfriends, fathers of your children, other relatives, your loved ones, right? Other children. It's up to us to understand the warning signs and symptoms of an ectopic pregnancy, first and foremost. Keeping in mind that each woman's experience with an ectopic pregnancy may vary. Keep that in mind because some women, right, they have vaginal bleeding or spotting a day or two before with mild pain. And then they catch it in enough time, right, where they can save their organs, where they don't have to undergo surgery and go through what I went through and what other women have went through. Then there's women again who might experience what I have, which is no signs. And then they just get hit with unbearable pain because the tube ruptured. And as a sidebar, don't it seem like the women that be popping out 3, 4, 5 babies easy, right? They be smoking cigarettes, popping pills, drinking alcohol while pregnant. They never have any complications with carrying a baby full term. Don't it seem like that to y'all? To me, it does. It's always the chicks that are reckless with their lives, with their health, with their children's lives and health, right? Don't know how to properly take care of a child. They be popping these babies out left and right. Now, that's not to say that those babies won't have any mental, emotional, or physical issues in the future. I'm just saying. I'm just saying. I hope that they don't, you know. Just something that I think about. Have you experienced an ectopic pregnancy or some other pregnancy related complications? If so, let us know in the comments. Or have you experienced racial bias in the maternal health care system or the healthcare system in general? Go ahead and share your thoughts in the comments. Don't forget to hit that like button. Peace.